size group here. Good morning. For those of you who I have not met, my name is Ruby Nguyen, and I am an administrative assistant here in the Division of Epidemiology and Community Health. Actually, I am sitting in Katie's cubicle today. So I'm going to have to borrow Jeff after the seminar. I don't have internet connection back in my old space. But having said that, I want to welcome you to seminar today. We are so pleased to be having an in-service that's sponsored by our research committee. So as you may know, each of our division committees host one seminar a semester, and the research committee has chosen this fantastic topic. In fact, the topic that was recommended to me and to us by a few different faculty sources. So I'm so very glad that they were able to pull this together. So let me make the introductions for our fantastic speakers today. Shonda Hunt and Wanda Marzalek are two members of the library's Research Data Services team and curators of the data repository for the University of Minnesota, which calls itself DRUM. Research Data Services has been leading education and campus preparation for compliance with the new NIH data management and sharing policy. So welcome back, Shonda, and welcome, Wanda.
Hey, good morning, everyone. Before I get started, I just want to share the slides with you all. I'll put that in the chat now. We're going to be sharing a lot of information with you, and so you may want to reference the slide deck at some other point or follow along. That's up to you. But again, the slides are for this presentation are at the link I just posted in the chat. Right, and now I'm about to share my screen. And can folks see the first slide? NIH data management and sharing policy. Okay. All right. So Shanda and I are going to get started here. I'm going to be presenting the first part, and then we'll switch, and Shanda will present and speak with you all. So the original, so the original data sharing policy from NIH that was in effect until last month was implemented in 2003, and it's pretty different than the one that was just implemented in January 25th. The pre-2023 policy mandated sharing the data for grants that were receiving more than $500,000 annually. Indirect costs. Researchers had to include a plan for sharing their research data or explain why the sharing of data was not possible, which some of you are probably familiar with. Our data curators here at Minnesota have seen a lot of data sharing plans from research teams in the era that simply said data from this study will not be shared due to privacy reasons. However, given progress, how we've all grown, and transparency is becoming more and more important, and reproducibility, and just culture is shifting. So the expansion of the infrastructure that is available for sharing sensitive data, this isn't really an acceptable reason anymore or valid. The previous policy also called for a timely release and sharing of data, which wasn't very explicit. And are the slides advancing? I just want to make sure. Okay, thank you. So the new NIH data management sharing policy became effective on January 25th, 2023, and it will apply to new awards only. Any research that is current and ongoing, this policy will not apply. I hope that gives some folks a little bit of sense of relief. It will only apply to anything awarded after January 25th. This does not apply to renewals. Oh, I'm sorry, I misspoke. This does apply to renewals as well. If the award is renewed after this date, it will now require the DMSP. And you might hear me saying data management and sharing policy or DMSP. I'm probably going to shorten it to DMSP for the rest of this presentation. The new policy is an update on the current policy. Now, all new awards will be required to discuss how they will manage and share their data. This is a fundamental difference, as many NIH awardees generate human participant data, which may have sensitive and private data. The new data management and sharing policy applies to all NIH-funded research, funded in whole or in part, that generates scientific data, including clinical data. It does not apply to other research activities such as training grants, infrastructure development, or fellowships. In other words, activities that do not generate research data. NIH does have a list on their website that lays out all of the specific grants and if they have data sharing requirements under this policy. And we recently had a question come in about an NIH career development grant, and it did require data sharing plan. So just want to share that with you. The data management and sharing plan requires both submission and compliance with the submitted plan as approved by NIH. I want to note that the DMSP represents the minimum requirements by NIH overall. However, certain NIH institutes, centers, or offices may provide more specific guidance that they will require you to follow. One example may be a specific repository that they may want you to deposit the data into. Other policies from NIH may also apply. For example, the genomic data sharing policy. Submission of the DMSP happens with the application for funding and budget justification section. It is a maximum of 2 pages long. Sometimes that's good to hear and sometimes not. We are seeing some that are coming in at longer than 2 pages, and so we're really helping folks try to get that down to the 2 pages. It will be assessed by peer reviewers as the grant is reviewed. Peer reviewers may comment but not score the budget section. Therefore, the DMSP will not be scored by peer reviewers. NIH program staff will also assess the data management and sharing plan. It has been noted that these plans can be updated. So as you progress through your research project, and note that your original plan may not be feasible or needs to be altered, the DMSP can be updated with NIH. It's kind of, you could consider it almost a living document that needs to go along with your project. And so if things aren't working out, it should really be updated. As far as compliance, the DMSP is incorporated into the terms and conditions of the grant. The DMSP will be monitored at regular reporting intervals, quarterly reports, or things of that nature that you already are turning in. Compliance with the DMSP may factor into future funding decisions from NIH, and that is something that NIH has stated explicitly. The elements of the data management and sharing plan include description of the data, including metadata and documentation, any related tools, software code, etc. If there are any standards for the data or metadata, what plans are in place for data preservation and access, and when those plans will go into effect. If there's any future access, distribution, and reuse considerations, and also who provides oversight for data management and sharing. Basically, the plan should include the type and amount of data that will be collected or used, including details around the data, around what data will be shared, and justification for data not being shared. Metadata and documentation should also be described, as well as who is responsible for the data preservation and access. This all might sound really familiar if you've created a data management plan or used data management plan template before, maybe with NSF. So I'm going to go over each of those sections now a bit more in detail. So first is the description of the data that includes the type and amount of data that will be collected or used. This includes data modality. If you are collecting this data from a survey, is it imaging data, or how is the data being acquired? This also includes the level of aggregation that will be collected. Is this the individual level, or is it at the aggregated data? And you want to be explicit about that. Finally, this includes the degree of processing of the data. Are you collecting raw data, or is the data processed or simulated in some way? You should also include what data will not be shared in your description of the data. That does include if you are planning to not share your data as a result of any legal or ethical considerations. In that case, you should provide a clear justification why you are choosing to not share. The description of the data should also discuss your data documentation and metadata. What we mean about documentation and metadata are things like metadata standards that are expectations in the fields, the way variables are described, study protocols, code books, and so on. I like to think of all these pieces as just being transparent, just sharing what your plan is and how you will be sharing it out, because in the end, this data is NIH funded, and it's so that way the public can access this data. So all of these things are really important for those that are going to be accessing the data or reusing the data. What counts as data for sharing? NIH requires that you share adequate data to validate and replicate any study findings. This means all data resulting from the study, including null findings that do not result in a publication. What does not count as data for sharing could include some of your documentation or things you captured as you performed the study, such as lab notebooks, preliminary analyses, draft manuscripts, peer reviews of manuscripts, and plans for future research. Or also things that don't need to be included are communications with colleagues or physical objects. The second aspect of the DMSP requires a description of any related tools, software, or code. It is possible that you might be using some specialized tools that are specific to access or process your data. You want to name those specific tools, such as Python, SPSS, software programs like that. Are the tools that you are using, are they open, meaning they are freely available? Or are they associated with a cost? Would folks have to purchase these tools in order to access or understand the data? And also, what is the expected lifespan of these tools compared to a lifespan of the data itself? So for example, if you were using even Python or R, what kind of toolboxes or what kind of libraries are you having to install to do that? You would want to note that. Also, which version or which year, in case there's problems further down the road, if someone is having a problem running the code or something like that, they can look back and see, oh, this is a different version than I'm running. And that might be the issue. The third element of the DMSP is standards. Standards come in all different forms. We can talk about standards related to data formatting, or we can talk about standards as to how data dictionaries are shared. For example, a README template is a good way to share project level metadata. Common data elements are standards for survey collection within NIH. It is a standardized, precisely defined question that is paired with a set of specific allowable responses that is used systematically across different sites. studies or clinical trials to ensure consistent data collection. Standards also include things like identifiers such as DOIs and definitions. Finally, when no clear consensus standards exist, you should note that as well in your DMSP. So with those standards, there may be some offices or institutions that may have specific requests. This is an addition. This is an example from NIMS, National Institute of Mental Health. And so for this example, the plan must include a schedule to validate the quality of the data being uploaded, so these data are compliant with data dictionary and other standards being used. The schedule is referring to the timeline of data submissions. Policy, I think, is every 6 months or so. And we'll talk a bit more about NIMS and NDA a bit later. The fourth element of the DMSP is data preservation, access, and timelines. You should name the specific repository or repositories where you will share your data. You're generally allowed to share your data in more than one place if you wish. You should note how you have chosen the repository. You should note how the chosen repository makes data findable. Do they use special indexing? If so, where is it indexed, and include that? Is it findable via Google Scholar? Does the repository offer persistent identifiers like a persistent URL or a DOI? You'll also want to include when you will share the data. It is important to know that the new DMSP policy requires that the data be shared no later than the time of publication or at the end of the performance period itself. You should also include the length of time that the data is anticipated to be available. Some repositories may have specific statements about how long the data is available. So for example, DRUM here at the University of Minnesota, we state that your data, we will protect and be able to share your data for 10 years. I don't even know what the data world is going to look like in 10 years. I mean, look at how fast it's been moving just in the last couple of years. Okay, the fifth element of the DMSP is related to future access, distribution, and reuse considerations. This relates to some of the nuances of handling human participant data, things like informed consent, that what were participants told about how their data would be shared, and where that data will be shared. Of course, we also have privacy and confidentiality protections in place. We want to be mindful of de-identification, especially with publicly shared data. However, we may need to think about de-identification even when where we're doing restricted data plans, which will be covered in a few slides down in the presentation. Finally, there may also be restrictions imposed by federal, tribal, or state regulations or policies. The sixth element of the DMSP is related to oversight. How is compliance within your research team going to be monitored and managed? Who is responsible for the oversight? And will oversight activities occur? And when will oversight activities occur? Example DMSPs from NIH talk about institutional oversight, which is a new aspect of data management plans. We are currently working with the Office of Vice President for Research and Sponsored Projects Administration, OVPR and SPA, to build resources and infrastructure around institutional oversight and compliance with the DMSP. Suggested language for what to write in this section of the DMSP is forthcoming. In the meantime, we suggest that PIs be responsible for the data management, uploading of data sets to repositories, and reporting out of these activities in progress reports. So a big question for many folks are, what are the acceptable reasons not to share data? Some reasons not to share data may include if there are informed consent limitations in place, or if the consent form was written in a really restrictive manner. You may also be using secondary data in which you didn't have control over the informed consent to begin with, and sharing may be prohibited. Sometimes the privacy or safety of research participants would be compromised or put them at risk of re-identification or suffering harm if we share the data. There are again considerations related to what type of data is being collected, the sensitivity of the data, the risk of re-identification, and where it is being shared. That is another delicate issue that we will be discussing shortly. As mentioned in the last slide, there may be very explicit federal, state, local, or tribal laws that prohibit disclosure. And finally, NIH does talk about possibilities that the data sets cannot practically be digitized with reasonable efforts. That would be another reason that they would consider to be acceptable for not data sharing. We've heard some concerns from campus stakeholders regarding potential consequences of not following the DMSP, given that it is written before research even begins. We all know that research plans shift as they progress. As we pointed out earlier, the good news is that DMSPs can be edited at many stages. NIH program staff, after they review it, may make suggestions for modifications before the award is even granted. Researchers will provide updates on data management and sharing activities in the reports to the funders, creating the opportunity for a shift in plans. NIH encourages working proactively with your program office to obtain, review, and approval of modifications to the original DMSP. All right, I'm now going to stop sharing my screen and turn it over to Shanda.
Thanks, Wanda. I will get my screen sharing all set up here. I was just bragging to Jeff right before we started here that I'm working from a hotel room in Duluth and I'm having no Wi-Fi concerns, and then the Wi-Fi dropped me while Wanda was presenting. So I am using my phone hotspot. So hopefully this holds out for us today. Let me know if I become really choppy and you can't hear me. So Wanda did a great job of covering the scope of the policy, the details, the expectations, what it all entails, right? And now I'm going to move forward and talk about various resources that are in place to help us implement this DMSP. So significant concern and questions are around budgeting. And what types of costs can we include for this in our grants is a good starting place for that conversation. So you can include in the budget the cost to cover any data curation and development of documentation that must be submitted along with data sets. And this can be during the life cycle, the duration of the grant itself. So that means you can also cover things like local data management during the project before submitting to a repository. So that might look like 0.5 FTE for a data manager who's really putting together that documentation and making sure the data sets are cleaned and ready to be shared. You can include costs for data de-identification. So some of that you might do yourself, but there may be data sets that are very large or require more of a statistician's expertise to be able to de-identify the data set. You can include those costs as well. And then, of course, you can include the costs associated with actually sharing your data in repositories. Some charge, some do not. So there is a link at the bottom here, allowable costs for management and sharing, that you can refer to in the future. So there are a lot of questions around exactly what does this cost? What should we be putting into our grants? The National Data Archive is an NIH repository. It is required, it's the required repository for a number of different offices, including NIMH, including NIAAA. And the National Data Archive has been around for a while. They're well established. They have a lot of rules around how the data gets deposited and the standardization process. And I think because they're more advanced than other repositories, they have put out some cost estimation tools, a cost estimation tool video tutorial. And in fact, it's so good that NIH overall is turning everyone to their materials to learn about how to budget. So this cost estimation tool helps you assess costs associated with repositories, labor, etc. Now, NIH has some more general guidance as well. We have their instructions, of course. They just came out last week with this new NIH budgeting FAQ. In section F, there are a lot of common questions that we are receiving here at the U of M, but also questions that they're receiving from folks nationwide. And so they are beginning to attempt to answer all of our questions and concerns about how do we do this, right? And then we have created with SPA, a U of M budgeting resource. So these are our local recommendations. We've been working really closely with Pamela Webb. We meet with her every 2 weeks. We're actually going to be updating this budgeting resource in the next couple of weeks as well with some more information that we have received from NIH. So all of these are really good resources. Now, the next big question that we tend to receive is, how do I know where to put my data? You might have a grant that specifies where you have to deposit your data. Like I said, NDA is required for National Institutes of Mental Health, for example. But if there's not a repository designated for you, you have to decide which one is best for your data. So there's lots of options out there. NIH has a number of supported repositories, like over 50, and they're all discipline specific. And so depending on the type of research you're doing and the type of data you collect, you may be able to put your data into one of those NIH repositories. There are what we call generalist repositories. These would be things like, if you've ever heard of Figshare, or Dryad. They're these very large repositories that take all different types of data, regardless of discipline, and they have different levels of cost and curation services. They also have different timelines in terms of when they can prepare and release your data. Now, if you have data that is very large, maybe it's not easily uploaded or downloaded to a repository. There is in existence very large compute heavy repositories, and we would welcome your questions to us about that, and we can help you find one of those if necessary. And then there's also institutional repositories. So a good example of that, of course, is our data repository for the U of M. We call ourselves DRUM, like Ruby said, and frequently institutional repositories, including DRUM, are fully open access. That means public can access all of the data that's in our repositories. So we're going to talk about that as a consideration. So regardless of what repository you choose, you should try to follow best practices when selecting one. So NIH provides you with a list of desirable characteristics for those repositories, and then OSTP has a list of desirable characteristics as well. And what they are really after is making sure that you select a repository that ensures fair data. And if you have never heard of that before, FAIR stands for findable, accessible, interoperable, and reusable. So they want to make sure that this data can be accessed, found, and reused in the future, right? So what does that look like for repositories? For findable, that means that they assign your data set something like a DOI, so that DOI can be found easily, maybe when it's associated with a publication, or maybe it's indexed in Google Scholar. It's findable if it's accompanied by metadata like keywords, for example. So if somebody's looking for a data set related to X, Y, and Z, it's tagged with those keywords X, Y, and Z. And it's findable if it's free and easy to access. For the accessible piece, we want to choose a repository that has plans in place for long-term sustainability. Wanda mentioned that we are currently confirming 10 years of data storage. There are some repositories that don't mention their guarantees at all. So that would be something you'd want to look for. Look at their retention policies and how they create a data lineage for their records. It's interoperable if the files and the metadata are shared in a common format and that there is curation in place. I'll talk more about that. And it's reusable if there's very clear use guidance, broad and measured reuse, and security and integrity of the data has been guaranteed, while still maintaining confidentiality as appropriate. Okay, so I'm just going to share a couple of examples and talk about some of the basic characteristics of these repositories. One example is NIDDK. This is an NIH repository. It's from the National Institute for Diabetes and Digestive and Kidney Diseases, NIDDK. So if that's where your research lies, this might be an appropriate repository. It is something called a restricted access repository. So that means you can see these little locks down here in these color boxes on the bottom right-hand side. So data requests, it has a little lock next to it. Biosample availability, a little lock next to it. So that means the data is discoverable. You can come to this repository and discover that this data exists here, but it's actually locked up until you register and NIDDK can verify who you are. And then you will be either accepted and you can access the data, or you will be denied and you will not be able to access the data. So that's what a restricted access repository does. Registered users only. In this case, the submitter verifies that they obtained consent to share their data. So that means you as the researcher will just basically check a box that says, yes, I obtained consent from the human participants to share this data. NIDDK reviews the submission, the data submission, and they do provide guidance for what they want to see in your consent form when they are accepting data to this repository. The next example we've mentioned a couple times, the National Data Archive, NDA. This is actually an aggregate repository. So it's a large repository that has some sub-repositories inside of it. So two of those are the National Institute for Mental Health Data Repository and the NIAAA Data Archive. Both of these exist within NDA. So if you're going to look for specific information from NIMH Data Repository, it's going to link you to NDA. So don't get confused when it's linking you to other repositories. That's actually pretty common. This one is also restricted access. Only registered users can access the data. Again, the submitter, the researcher, verifies that you had consent to share. And there's also guidance for consent language that they want to see when you are depositing into this repository. And kind of on the other end of the spectrum is Drum. Like I said, we're a fully public repository. Any person on the internet can discover this data and access it. We offer strong curation. So we have a number of curators who review the data, make recommendations for possibly de-identification. We assess the consent form. and decide if the consent form was strong enough for sharing in a public repository. We do file transformation so that the files are interoperable. We run code when possible to ensure that it's executable. We assign a DOI. So there's a lot that goes into our services here. We also anticipate, even though we do have human participant research in DRUM. We anticipate that DRUM will not be appropriate in a lot of circumstances for NIH sponsored research due to the fact that there's going to be the need for a lot of de-identification, which may reduce some of the value of the data set. And therefore, you might want to put it in a restricted access repository where it can be the full data set, and then it's controlled who accesses it. So sharing human participant data, of course, has a number of special circumstances. We need to think about, again, de-identification and that informed consent process. Many NIH, but not other repositories. So not generalist repositories and not a lot of institutional repositories have requirements about informed consent. So that's something that you don't get a lot of guidance about. So we'll want to be very careful there. There are two supplements to this policy that are very helpful. One of them is responsible management and sharing of American Indian Alaska Native participant data. And the other one is more general, protecting privacy when sharing human research participant data. You might want to consult with both of those as well. We're going to cover some of the details currently, and I'm going to start with the Certificate of Confidentiality, which has been issued to all NIH grants since 2017. And we all are probably aware, but COCs cover identifiable and sensitive data. So it protects disclosure of that information in many legal circumstances, right? So if you have a COC, which if you're NIH funded, you do, you may not be able to share all your data, right? You can still share the de-identified, non-sensitive portions of your data. You can share and must share with consent. So consent has to be explicit. And then you can also share in one of those restricted access repositories that can uphold the COC. Let's start with the de-identification process. So also known as scrubbing, cleansing, cleaning. It's a very complex topic. The most concrete guidance we have is for data that falls under HIPAA. And there is something that they have called the safe harbor method for de-identification. And there are 19 identifiers, and we're familiar with those. Those are names, those are social security numbers, dates of birth. Their 19th identifier, though, is other. And that's what a lot of us are concerned with in terms of curators sharing data in a public data repository. Those other identifiers are often things that we call indirect identifiers. And we're really looking at a combination of variables, right? So does variable X and variable Y, when put together, can we identify people? Folks sometimes turn to the common rule for de-identification, but the common rule really doesn't address data sharing. It's really talking about de-identification in terms of how it can be ascertained by the investigator. And we need to think beyond that. So strategies for limiting disclosure. One of the most, I think, easily accessible methods is to just remove those risky, low utility variables. So of course, those are our direct identifiers and sometimes other types of variables that could be identifiable in combination with others. So we can remove those. We can recode or collapse categories with small frequencies. Age is a good example. We can review possible links to external files. So reviewing possible other information and data that could be found on social media, other study websites, news articles, for example. A good example we had in Drum, it was a definitely not a sensitive set of data, but it was a study of human participant body motion on ships. And it was de-identified, but we had enough information that we could locate the Navy ship, is it called a manifest? Which listed all of the passengers that were on that ship. So we were actually able to de-identify the entire data set based on some public information that was out there. So we recommended changes to that data set so that they would be better protected, right? You might release a subsample of the data. And again, you can share through restricted access methods where you can vet who is requesting the data, or you can share with repositories that offer data use agreements. So there's an agreement between the data submitter and the data user. A really common problem that we see with data sharing is the informed consent language. So examples of really restrictive data sharing language that we have seen over the years include things like any reports or manuscripts will not share information that can identify you. This is misleading, I think, in terms of data sharing, because we're not talking about data in that statement. We're talking about, manuscripts. We're talking about, presentations. A data set is quite different. We're talking about individual level data. We often see data will only be shared in aggregate, which is usually not the case when data sharing. Data will only be seen by the research team. We can't guarantee that when we are sharing. And that data will be destroyed. That's another common one. And of course, when we're sharing data, it kind of puts it out there forever. The data does not get destroyed. The best guidance for informed consent language will come from the data repository that you use. If they don't have any, fall back on some of these recommendations that we're making here today. So for example, if you are sharing data in the National Data Archive, they require that the informed consent states that the data will be shared in NDA. It explains the de-identification process in full. It explains the purpose of sharing the data, who will have access to the data, and the process by which that person gains access. And it outlines the process for revoking their consent for data sharing. So it's very extensive. Another example is ICPSR. Some of you in speaking with us in the past might be familiar with ICPSR. This is a repository run by Michigan. And we frequently turn people here because it is a well-known social science data repository with lots of public health data sets in it. So it's discoverable. People know about it. You can also choose to make the data open, or you can choose to restrict it. ICPSR has some of the best recommendations out there for recommended language. So their website shows known concerns, some of those things that I just talked about, and then offers you alternative language. It addresses things like promising anonymity, talking about that information versus actually explicitly talking about data. It talks about restricting that problematic restricting access to the research team. Sometimes we see language in consent forms that's really talking about data storage versus data sharing. So they address that. Promising end dates to when the data will be shared, and participant disclosure. We also have guidance, and we have a data sharing policy, but we also have guidance around the consent process. And when we are reviewing data sets for ingestion into Drum, there's a data curator who requests that consent form. And we review it and make sure that the data set has been fully de-identified to the best of our knowledge. We are not certified. One of us is a statistician. It's not me. So there's someone who has a lot of really great research knowledge who can help us with de-identification, but that's one person, right? So we do our best with the de-identification process and making recommendations. We try to ensure that the consent form is free of restrictive language that would prevent data sharing. We hope that the consent form states that individual level data will be shared, and we hope that the consent form states that the data will be shared publicly. And we kind of have a, we'll accept it if it's not really sensitive data set and do some education, and it's a 2 strikes and you're out situation. So we allow it 2 times, provide more education and training around what we want to see in that consent form in the future. And then if you continue to submit data sets that didn't use proper consent, we'll no longer accept them. So what can we do for better language? I mentioned that ICPSR has some good recommendations. If we're promising to eventually destroy the data will be destroyed in 5 years or 7 years. We see that a lot. We can just be very upfront about what will be destroyed and what won't be destroyed. So we can say we'll destroy the direct identifiers, any linking information, maybe the participant key, audio files potentially, because they are very identifying. But we're going to retain and preserve de-identified transcripts, and we'll be sharing those in X, Y, and Z. Instead of saying responses will only be seen by the research team, we can say identifying data will be kept confidential, and only that de-identified data will be shared with others in either an open access or restricted data repository. And instead of saying data will only be shared in aggregate, we can say individual responses will be shared, but in ways that will not identify you. And again, being as explicit as possible is a really good idea. So then taking it a step further and explaining that de-identification process. There are a number of additional resources that we want you to have. Of course, the first 3 come directly from NIH. They are still making changes. They are still coming out with resources. So be sure that you're visiting these sites frequently, because new information is coming out. We use them all the time. There is an NIH DMSP template in a website called DMP Tool. So there's 2 links in that 5th bullet, because when you open up DMP Tool, you can log in as a U of M person. So that will add drum language to your template that you're creating. You can also at the same time create a DMSP in DMP Tool. So they will be using the DMSP template, but also making recommendations for drum language, right? You can then, when you submit it, you can submit it to us, to the Research Data Services team for review. So then we will look at it and we will provide feedback. We, the Research Data Services team, we have FAQs that we've created based on the types of questions that we've been getting along the way since we started doing these presentations in August. There is great guidance from TalkBank and Syracuse regarding consent forms for qualitative data. And then we want to cover what we can help you with. So like I said, we review those DMSP plans and provide feedback. We do education and training around not only data sharing, but also data management. We do the curation and preparation for drum. We can also consult with you on preparing your data for other repositories. So we don't do the curation for you necessarily, but we can consult with you and kind of guide you in what types of documentation and things you'll need if you're going to submit to another repository. You can find our information at lib.umn.edu/services/data, and you can email us at data@umn.edu. And I'm going to leave you with this final contact information and see if you all have any questions at this time.
Shanda and Wanda, thank you so very much. As she said, they welcome questions. Feel free just to unmute. We are a friendly group today.
I have a question.
Hi, Jennifer.
Hi, thanks for joining us. I mean, I have lots of questions, but one thing I'm going to ask is IRB working on changing the consent templates that they offer for us to download, or is this something that we're just going to have to sort out individually as investigators?
They've already done that.
They have. Okay, fantastic.
So we worked with them over the last couple of years to offer options
Great.
in terms of restricted versus data sharing options.
Perfect. Thank you. And you mentioned documenting code books and protocols in the proposal, but it's 2 pages, right?
Yeah, so you would just mention how you're going to share that metadata with the data set.
Okay, fantastic.
What
Because I started,
types?
right, because these are things that like we pay someone to do once the grant is funded. And so I just wanted to confirm they didn't
Right.
expect us to hand those over at submission.
Good question. So you're not handing over any data, metadata. You're just describing a plan for what you will do in the
So no
future.
code books either.
Correct.
Okay, just wanted to be sure because
Yeah,
there's a lot going on here. Thank you.
yeah, of course.
So there are a couple of questions in the chat. I'll first read the first one. I'll read the first one from Allie. She thanks you for the great presentation. Can you please discuss transcripts and sharing of other types of qualitative data regarding sensitive topics?
Yep. So that would be likely one of those cases where you would use a restricted access repository. There is the likelihood that we can't de-identify a transcript to the point where it's still reusable and valuable. There is a repository called the Qualitative Data Repository that is run by Syracuse. They are very familiar with qualitative data curation and can work closely with you. That one does come with a fee. So that would be one that you would want to consult with them ahead of time and make sure you know what their costs are for depositing data there.
The next is a legal question. This is from Jim. If someone is re-identified from this de-identified data, who is legally responsible for the harm?
Yeah, so it's our understanding that the PI is the data steward. So there have been cases in the past where the research team has faced legal consequences from folks being re-identified. I think this is a really good conversation to continue in terms of how we phrase things in the consent form, because we can ask folks in the consent form if they want to withhold their data from a data set that's shared. We can do a tiered consent where they can say, I only want X, Y, and Z shared and not W, etc. So it's up to the research team to ensure that the human participants are protected. And therefore, we would want to, again, think, Jim, more carefully about what type of data repository we're using and who has access to that data as well.
The next is a comment from Ellen, and I invite everyone to read Ellen's comment, particularly those who are working with prospective cohorts. So her comment reflects that with prospective cohorts and including what you just described, Shanda, the consent form is going to change, and people consent to different things and sometimes rescind things with the new form. So she's suggesting that, well, because of these differences over time, that an individual might not, we might not be sharing the complete individual's data, and in fact, with regards to all of our participants, ultimately only be sharing a small portion of them because of these differences in consent over time. So like I said, I invite everyone to read Ellen's complete comment. The next question is from Rich. Can consent forms offer individuals the option of not having their data put in public repositories?
Yes, absolutely, Rich. So, like I said, there's a really good example on one of those last slides from TalkBank that offers tiered consent. So I consent to having all of my data shared in a de-identified way, or I consent to transcripts being shared, and they can check yes, no. So there can be different levels of sharing. They can also choose not to share their individual level data at all.
Are there any other questions or comments?
It looks like Pamela has their hand up.
Hi, I was just going to ask, so some of the data I work with, they're commercial data, and based on the licensing agreements, I am not allowed to share those data.
Yep.
And so I actually just submitted an R01 and with a resource sharing plan and was trying to figure out how to address this. So I say I'll share the data analysis protocols and code, but is that, I mean, these data can't be shared. So have you heard anything about exceptions in those sorts of situations? Because it's the actual licensing agreement.
Absolutely. So that's what Wanda was talking about on that slide that was reasons not to share. So that would be one of those considerations where there is a legal contract, license, use agreement in place that says this cannot be shared. Yeah, absolutely. And even your offer to publicly share the code, etc., is great, is wonderful and thoughtful and beyond what a lot of people are even considering right now.
Well,
So,
it was hard to, as I said, I just had to do this for a grant I submitted this week, and it was grasping at straws, thinking about what can I do, you know?
yeah.
Okay,
Yeah.
thank you.
Thanks.
Teresa, do you want to unmute or do you want me to read it from the? Maybe I will read it. From
Those are two separate things. I wanted to comment on
Okay.
Pam's comment by saying that people could acquire the data separately. And that's what we do a lot with secondary data analysis, state where they could get the data, which is often not clear. And then they would have to acquire the data separately if it were proprietary or licensed.
And I did provide that information, but it's, yeah, there's
Right.
not a lot you can do.
And so my question has to do with how extensive the data sharing has to be. I mean, I understand the principles that are guiding this, of course, but if we have limitations on what is allowed to be shared, for example, different participants allowing different degrees of their consent to share, is anything that we publish required to be shared in that form? So I'm talking more about, you know, data sets that share one version of the data set that presents most of the variables and most of the participants in a de-identified way versus, you know, subsets of the data set that may be specific to each manuscript. I've seen social scientists release data sets that are specific to a hypothesis that they test, and they release, you know, 10 or 20 variables for the participants. But once you start aggregating those data sets across many manuscripts, if you can relink them through the variables that have been released, that becomes a problem. And of course, that's more difficult to release one per manuscript.
Yeah. So really excellent question. And I'm going to go back to the policy itself, which states all data collected from the study has to be shared, including null findings, data that did not lead to a published manuscript. And so researchers might share the data in chunks like you're talking about, like this subset led to this manuscript, so on and so forth. Or you might just release one large data set that the various manuscripts can point to.
Great,
Like,
Jim.
how do you, I guess my question is, how do you deal with restricted data that, or levels of data? For example, if you have a geographic version of the data set that is separate from a fully de-identified data set.
Yeah, so you need to decide what level of de-identification will need to be required for the data set in order to submit it to a particular repository. So for example, if you were to use Drum, that geographic information cannot be included in the data set. If you were to use something like ICPSR, where it can be locked and then vetted and make sure that another researcher with an IRB approval is accessing the data set, that's a different level of sensitivity that can be included.
Okay, thank you.
Jim, go ahead. Oh, Jim's gone.
Yeah. So while I appreciate the kind of idea of having this layered consent with different options for participants, our experience is one of the things that happens with that is it raises a lot more questions from the participants about what does this mean? What does that mean? And often our staff collecting the consent can't readily answer those questions because they're not experts in de-identification or experts in the technical aspects of repositories. So I think there's some downsides to that kind of idea of this layered consent.
Yeah, I don't disagree. We have heard concerns about participants participating in research if their data is shared. We do have a template that we give to researchers that they can hand out to their participants that explains data sharing, why it's done, how it's done, to potentially help ease some of those questions that might arise from participants. But yeah, I think we're gonna kind of see what happens in the future as this rolls out, Jim.
Simon.
Yeah, just two quick practical points. First, a huge thank you to Shanda for your feedback to us on a grant going in today and the new plans. And just for newer investigators in the division, we've put our example into the faculty, or we made it available to go into the faculty toolkit. And I'd encourage others to also do that so that as we're all learning this, we can be taking a look at some models and seeing how each other's doing it.
Thank you.
Thanks, Shanda. You're brilliant.
Thanks, Simon.
Yeah. So that concludes our time as well. It looks like, as well as the questions that we have for today. Thank you so much for making yourself available today as well as in the future by providing your contact information. We very much appreciate and look forward to working with you. Bye, folks.
Thank you.